Welcome to the training on convalescent plasma in the recovery trial. This is the current trial design that you're probably familiar with. Eligible patients, that's those admitted to hospital with proven or suspected SARS-CoV-2 infection, can be randomised between a number of different arms. At the current time, the existing arms are no additional treatment or azithromycin, but it is possible that in the future other arms may be added to this randomisation. And then for patients that deteriorate, there is a second randomisation between tocilizumab and no additional treatment. We have added a factorial randomisation to that first randomisation so that patients going into the trial can also be randomised to convalescent plasma or no additional treatment, and the rest of the trial continues as normal. So when we put that all together, we end up with a design that looks like this, where patients being randomised are randomised both between standard of care and azithromycin at the moment, and possibly other arms in the future, but at the same time they are simultaneously randomised between convalescent plasma or no convalescent plasma. And then the second randomisation can continue as normal after that. This allows the trial to assess the effects of both azithromycin or other arms against standard of care, and at the same time also assess the effects of receiving convalescent plasma versus not receiving convalescent plasma. We are testing convalescent plasma for a number of reasons. Convalescent plasma has been donated by patients who have recovered from COVID-19 and contains antibodies which may neutralise the SARS-CoV-2 virus. There are some poor quality data from other studies to suggest that convalescent plasma may be effective in viral pneumonia, but more robust tests are needed in larger randomised trials. So convalescent plasma has been included in the recovery and REMAP-CAP protocols with support from NHS Blood and Transplant. So convalescent plasma, a picture shown here on the right, looks just like fresh frozen plasma frequently used in hospitals, but has been selected because it contains these antibodies. The consent form has been updated, and it's important that version 5 of the consent form is used, and there is an extra line on the consent form now asking participants if they are willing to receive convalescent plasma, and they need to initial the relevant box if they agree or not. The online randomisation system, which you're probably familiar with now, then has a few additional questions about the participants' willingness to receive convalescent plasma, in other words, the answer to this question, the participants' suitability for convalescent plasma, and we'll talk about that in a minute, and the availability of convalescent plasma at your site. After the randomisation, the allocation will be displayed alongside the allocation from the main randomisation. So you will see both which drug, if any, they are to receive and whether they are to receive convalescent plasma or not. It is important for you to remember that just like all blood products, convalescent plasma cannot be supplied by your transfusion lab until 2 group and screen samples have been sent, taken at separate times. It may be that one of these is sent as routine when a patient is first admitted to your hospital, but it's important that that be followed with a second sample before the lab can issue the convalescent plasma. And before prescribing the convalescent plasma, please consider potential risk of transfusion-associated circulatory overload, which I will talk about more shortly. So the potential hazards of convalescent plasma include a phenomenon called antibody-dependent enhancement. And this is a theoretical risk that antibodies may promote viral entry into cells and therefore accelerate the disease. This has been shown in laboratories, and there is no clear evidence of this yet in humans, but it is a potential risk. The second risk, which is common to all blood products, is transfusion-associated circulatory overload, and this needs careful consideration before prescribing the convalescent plasma. And again, just like any other blood product, the potential for hypersensitivity reactions exist. Transfusion-associated circulatory overload is the most important cause of morbidity associated with transfusions. And there is a TACO checklist available on the study website for you to use. But it's important before prescribing that you consider the patient's cardiac status in terms of their risk of suffering circulatory overload, their pulmonary risk in terms of their risk of pulmonary edema, which is the worst consequence of circulatory overload, and their fluid balance. Many patients with COVID-19 may be slightly dehydrated from the fever, but this needs careful consideration, and it may be appropriate to either delay the convalescent plasma transfusion until these issues are addressed, or give it at a slower rate, or give it with a diuretic. Convalescent plasma for adults is prescribed as 1 unit, which will be approximately 275 millilitres on days 1 and 2, with the 2 transfusions occurring at least 12 hours apart. The paediatric dose is 5 millilitres per kilogram, and there are further details about neonatal prescriptions in the protocol. Please administer the first unit as soon as possible after randomisation, and within 4 hours of defrosting if it is stored at room temperature, although if refrigerated, it can be stored for up to 24 hours. All your standard administration checks as per your local transfusion policy should be completed and documented as normal. If there are any adverse reactions, please inform the managing medical team so they can take appropriate action, and please also inform your transfusion laboratory or practitioner who will help to complete the serious hazard of transfusion reporting required for all transfusion reactions. If the reaction occurs with the first unit, please reconsider before deciding whether to give the second unit or not, and please document everything in the medical records. We will be conducting some additional early safety data collection for the first 200 participants randomized between convalescent plasma and control. So we would like for your team to record whether in the first 72 hours after randomization, during which time they should have received their 2 units of convalescent plasma, the participant has had any of the following 5 issues: a sudden worsening in respiratory status, a severe allergic reaction, a temperature more than 39 degrees or a rise of more than 2 degrees above their baseline, sudden hypotension, as defined on the slide, or clinical hemolysis, again with further information on the slide. It's important that these are recorded, not only for people assigned convalescent plasma, but also for the people randomized to receive no convalescent plasma in that randomization, because many of these events may occur in people simply who have COVID and not necessarily related to the transfusion. We'll also ask you to record how many units of convalescent plasma were given and whether any were stopped early. And this information will be collected on an additional Open Clinica form, much like the main study follow-up form. In addition to this, as I've already said, standard serious hazards of transfusion reporting will also be used for all participants receiving convalescent plasma, and your transfusion lab and practitioners will be able to help with this. So in summary, convalescent plasma is being offered in a factorial randomization at entry into recovery. The sites that we are selecting will be relatively few to begin with, but we hope to build it up across the UK with time. Participants may opt out of this part of the trial if they wish, but still participate in other aspects of the trial. Please ensure that all participants are considered for the risk of transfusion-associated circulatory overload before administering the convalescent plasma, and that should be given according to your local policies for blood products. And don't forget, the first 200 participants in this randomization are going to have extra safety information collected to help guide this randomization in the trial going into the future. Thank you very much.